Good. Welcome, everybody. I'm Dr. Cliff Smyth from the College of Integrative Medicine and Health Sciences, Department of Mind Body Medicine. Welcome. So, we'll do a mindfulness of breathing practice today. Many meditation practices have a focus or anchor for our attention, and many make use of the breath in that way to help promote mindfulness. So, just establishing a sitting posture with which you'll not have to change so much during this shortish time of practice. So comfortable, and thinking up along the spine, thinking vertebrae by vertebrae, inviting relaxation at each level so that the spine can be long and flexible. Thinking up along the spine so the spine could be long and flexible and as much as possible without tension. And bringing awareness to your sitting posture. The shape of the body, the bends at the joints, the space that you fill. Knowing this is how I'm sitting. And bringing mindfulness to the forefront. And sometimes this is translated as establishing mindfulness right in front of you. So bringing your awareness to the continuous flow of consciousness. You're always conscious, but sometimes we notice, we're aware. So noticing what you notice. And there may be some aspects of your bodily experience which you often check in on when you begin your practice, right? Or there might be some current sensation in your body, or something in the environment that's taking your attention right now. A noise, the temperature of the air, something that you can see. Just noticing what you're noticing as you start to establish your awareness, being mindful. Just bringing awareness and making a commitment to be awake and aware for the length of this short retreat from the flow of your life. And part of this drawing back and drawing in a little might be to close your eyes or soften your gaze. And bringing your attention now to the breath. How do you experience the breath just now? Again, you may have some usual way of attending, perhaps feeling the air in the nostrils or the temperature of the upper lip, or some movement of breathing in the body. The movements of breathing in the torso, the abdomen all around, the chest, the ribs and spine and breastbone. Or some other sensations of breathing in the body. With each breath in and each breath out, sensing. Begin there, wherever you're sensing the breath, if you care to, and just registering in awareness as much as possible the coming and going of the breath, the experience of breathing. And you might say to yourself, if it's helpful, breathing in, I'm aware that I'm breathing in. And breathing out, I'm aware that I'm breathing out. Or you might even say to yourself, I'm aware of the full duration of breathing in and breathing out. I'm aware of the full duration of this in-breath and this out-breath. Inviting an overall sense of breathing, an overall sense of breathing in the body and the body breathing itself. There are so many things that you can notice about the breath, the sound, the vibration, the effort or the ease. And all the ways the breath changes too, breath to breath. You might also notice the length of each breath or the size of each breath in the body, which also often change. Noticing without judgment, the breath arises and leaves in its own way, depending on the needs of the body. You might say to yourself, if it's helpful, aware of breathing in and out. I breathe in long, or I breathe out long. Or you might say to yourself, aware of breathing in and out. I breathe in short, or I breathe out short, without judgment. Sensing the breath. Now begin to bring your attention to the whole body, sensing your body sitting there, shape, maybe the touch of the air in your clothes, the space that it fills, and any feelings inside. However you can bring your attention to the body. You might even use the breath to direct attention to the body. You might even use the breath to direct attention to the body. Perhaps imagining breathing into all the parts of the body. Breathing in and out and sensing the whole body. Breathing in and out and sensing the whole body. As much as you can, to whatever extent possible. and inviting a sense of calm, still being aware of breathing in and out, and finding out, can you use it to calm the body? Being aware of the breathing and easing, being aware of the breathing and softening, being aware of the body and uncontracting, expanding, lengthening, breathing. Breathing in and out and calming the whole form of the body. Inviting a sense of calm, aware of the breathing. And finally, for our practice today, inviting the possibility of a feeling of joy or feeling joyful. There may be joy just in breathing or being aware of the calm flowing from awareness of breathing. Perhaps a quiet, sustained enjoyment of awareness and of breathing, inviting feeling good. So you might invoke those feelings that come from doing something from someone else that you've chosen to do. Or seeing someone doing something for someone else, taking care of someone. What does your body feel like with this kind of joy? Relaxed? What do you feel in your face? Maybe some smiling, maybe feeling a little more expansive. However you imagine it, bring some sense of joy now to this end of the practice. What does it feel like in your heart space? How do you breathe now as you just invoke some sense of joy? Evoking feelings of joy as you can. Aware of breathing in and out, experiencing joy. Aware of breathing in and out, experiencing joy to whatever extent possible. And sitting with any feelings of joy, breathing, aware of your breathing. And slowly coming back to being aware of your body sitting there, of the room that you're in, the light. You might open or refocus your eyes. Make some movements if you feel called to. And coming back to the group on the screen as you wish. For this practice, I drew on some of the steps of the Buddhist practice found in the Anapanasati Sutta. And I drew on the writing of Bhikkhu Analayo and Thich Nhat Hanh, and my teachers, Ayya Santusika and Ayya Chidananda. And that's the end of our practice for today. Thank you.